Persistent adult acne, sudden, unexplained weight gain, excess facial hair, and the inability to get pregnant. Up to 15% of women of reproductive age experience this exact combination of issues. They are all side effects of a single condition, Polyendocrine Metabolic Ovarian Syndrome, or PMOS. You might also know it by its former name, PCOS. On the surface, it is difficult to see how one syndrome triggers superficial skin issues, metabolic weight problems, and reproductive failure all at once. To understand these disconnected symptoms, we have to look deep beneath the skin to find where the body's internal signaling system begins to fail. The biological chain reaction begins long before any reproductive symptoms appear. It starts with two metabolic issues: chronic low-grade inflammation and insulin resistance. Normally, insulin helps cells absorb glucose for energy. But in insulin resistance, cells fail to absorb glucose molecules, causing sugar to build up in the bloodstream. Sensing the blockage, the body overcompensates, flooding the system with massive excess insulin to force the cells to respond. This initial metabolic processing error triggers the shift in reproductive hormones that follows. The unnatural spike in insulin acts as a faulty signal to the ovaries, instructing them to overproduce male hormones known as androgens. An ovary attempts to release a mature egg, but the process is completely blocked by a dense concentration of excess androgens. Because eggs fail to release, ovulation stops entirely. These trapped eggs then form small, fluid-filled sacs around the ovary's outer edge. While these sacs, called cysts, are where the condition originally got its name, a patient does not need to develop them to suffer from PMOS. Meanwhile, those excess androgens don't stay confined to the reproductive system. They exit the ovaries and circulate outward into the bloodstream. By the time these male hormones reach the skin and hair follicles, they manifest as heavy facial hair and treatment-resistant acne. Because patients present with highly inconsistent combinations of these symptoms, some struggling with acne, others with infertility, accurately diagnosing the condition is a challenge for doctors. To solve this, doctors rely on a clinical framework. They use a strict 2 out of 3 rule to make an official PMOS diagnosis. The first possible criterion is a history of irregular menstrual periods. The second is confirmed clinical signs of high androgen levels, identified either through a blood test or physical traits like excess hair growth. The third possible diagnostic criterion is medical imaging, specifically an ultrasound that reveals an enlarged or polycystic appearance of the ovaries. This flexible diagnostic framework allows doctors to accurately identify the root metabolic syndrome, regardless of which specific symptoms the patient exhibits in the exam room. While there is no permanent cure for PMOS, its effects are highly manageable. Clinical treatment splits into 2 distinct paths dictated by pregnancy goals. Symptom management uses hormonal birth control and insulin-sensitizing medications to regulate cycles and the metabolic system. The fertility path relies on advanced ovulation-inducing drugs, or in vitro fertilization, to bypass the blocked ovulation process. Through these targeted medical interventions, many individuals with PMOS successfully overcome the infertility barrier and carry healthy pregnancies. Treating PMOS requires looking past immediate symptom relief. The underlying syndrome carries hidden long-term risks. The sustained metabolic imbalance puts PMOS patients at a higher risk for severe secondary conditions, specifically cardiovascular disease, high blood pressure, and diabetes. Managing that root insulin resistance relies heavily on daily lifestyle adjustments. Eating a nutritious diet, exercising regularly, and maintaining a healthy body weight help the system process blood sugar correctly. Managing PMOS is a lifelong strategy. By controlling the underlying metabolic imbalance, patients protect their total bodily health and future.